name's Jacqueline. I'm a student nurse from Kobe Sawyer College, and I'll be doing your head-to-toe assessment today.
Hi,
Can I have your name and date of birth, please?
Emma Collins, 12/8/94.
Great. Oh, your birthday was just yesterday. Happy birthday, Emma.
Thank you.
All right, so can you tell me where you are today?
I am in the basement of Colgate.
And what brings you here?
Just a general assessment.
Great. How are you feeling today?
I am feeling good.
Great. And are you on any current medications?
I am not.
Any allergies?
No.
Great. So to begin, I'm just going to start with your vital signs. So first, I'm going to take your temperature. Are you feeling warm?
I am not.
And no recent chills?
No.
Great. All right, so just under your tongue, please. .5 degrees Fahrenheit. Perfect. Now I'm going to check your radial pulses, please. Just relax. Alright, your radial pulses were equal bilaterally, 64 beats per minute, and I also checked your respiration rate, which was 14 breaths per minute, both of which were normal. So next I'm going to take your blood pressure. Alright, so just going to feel for your brachial pulse. Okay. So I'm just going to wrap this around your arm really tight. So I'm just going to see at what pressure it can't feel your brachial pulse. Alright, so at 120 I couldn't feel your brachial pulse anymore. So now I'm going to pump it up to 150. Alright, your blood pressure is 110/78. Does that sound typical to you?
Yes.
Also going to take the blood pressure on your other arm. Feeling your brachial pulse again. Alright. Again, I'm going to pump it up to 150. Right, so very similar, 108 over 80. I'm also going to get your oxygen saturation. So just on any finger, please. I'm looking for anywhere between 90 and 100%. 98%. Great. And Emma, are you in any pain currently?
I am not.
Great. So I'm just going to take a look at your hands now. Your skin looks good. No excessive moisture. Got a little cut, but it seems to be healing well. Also going to check your capillary refill. Color returns within seconds. And I'm going to check your skin trigger. That's normal as well. So at this point, I can note your general health. So you appear to be overall healthy. You appear your stated age. You're clean and well groomed. You are alert and oriented because you're responding to my questions appropriately. And you appear to be sitting there relaxed. And yeah, so are you ready to get started?
I am.
Okay. So starting with your head, I'm just going to palpate. Any tenderness?
Nope.
Great. So I'm just making sure your skull is intact and your cranium is symmetric. Your hair distribution appears to be even. I don't see any pus inhabitants and there were no lumps with palpation. I'm going to move on to your ears now. Any tenderness?
Nope.
Great. Your canals are clear, there's no physical deformities that I can see, no discharge coming out of your ears. And you're wearing earrings today? Any problems with those?
Nope.
Great. So now I'm going to have you close your eyes for me and cover one ear, please. I'm going to repeat a combination of numbers and letters, and I'm just going to ask you to repeat them. 1, 2, H.
1, 2, H.
Perfect. And the other one? XY4. Perfect. Your acoustic cranial nerve or cranial nerve 8 is intact. So next I'm going to move on to your eyes. Any trouble with vision?
Nope.
Great. So first I'm just going to use the 6 cardinal positions of gaze. So can you just keep your eyes on my finger and only with your eyes follow my finger, please. Okay, great. I'm also going to check your pupils. I'm just making sure they're equal and round and that they're reactive to light. So just stare at the wall behind me. Okay, your pupil is constricted equal bilaterally from 4 millimeters to 3 millimeters. So those tests tested your oculomotor, trochlear, and abducens cranial nerves, or cranial nerves 3, 4, and 6. So now I'd like you to read my name tag, please.
Jacqueline Sinelli, comma, SN, Colby-Sawyer.
Perfect. And now I'm going to assess your peripheral vision. So I'm going to place my hands back here and just let me know when they come into view.
Yeah.
Great. Your optic nerve or cranial nerve 2 is intact. So next I'm going to move on to your nose. Is there any tenderness with palpation?
Nope.
Great. I don't see any discharge coming from the nose. And your septum appears midline. Do you have any problems with smelling?
No.
Great. So if you can close your eyes for me. I'm going to place something under your nose. Can you tell me what you smell?
Gum.
Yes. Your olfactory nerve or cranial nerve 1 is intact. So now I'm going to assess your muscles of mastication. Can you clench your jaw for me, please? And don't let me separate your jaws. Great. Close your eyes once again for me, please. I'm going to touch your face. Every time you feel any touch, just say now.
Now. Now. Now. Now. Now.
Great. So your trigeminal nerve or cranial nerve 5 is intact. Can you smile for me? And frown, and lift your eyebrows. Close your eyes tightly, and puff out your cheeks. Okay, so ear escaped equal bilaterally for each side. So your facial nerve or cranial nerve 7 is intact. Okay. Can you repeat light type dynamite for me?
Light type dynamite.
Great. Your cranial nerve 12 or your hypoglossal nerve is intact. So now I'm just going to move on to looking at your lips. There's no cracks or lesions, no physical deformities. They're pink and they appear to be moist. So now I would like you to open your mouth and I'm just going to take a look. Can you stick out your tongue and say ah? Great. Your uvula rises. So your glossopharyngeal or cranial nerve 9 is intact. Your tonsils are visible and 1+. Your teeth are there without decay, and your buccal mucosa appears pink and moist. Do you have any trouble swallowing?
I do not.
Great. Could you swallow for me, please? Great. Your vagus nerve or cranial nerve 10 is intact. So now I'm going to place my palm on your cheek. Can you rotate it that way? Great. And now your other one. Okay, and can you shrug your shoulders? Awesome. Your spinal accessory nerve or cranial nerve 11 is intact. Can you repeat light, tight, dynamite?
Light type dynamite.
Great. Your hypoglossal or cranial nerve 12 is intact. So now I'm going to move on to your neck. Any tenderness?
No.
Great. I'm just looking for any deformities. The skin looks good around your neck. And I do not see any jugular venous distension, so that's great. So now, Emma, I'm going to move on to your respiratory assessment. So have you had any history of respiratory infection?
I have not.
Any asthma?
Nope.
Trouble breathing?
Nope.
Chest pain with breathing?
Nope.
And how many pillows do you use under your head at night?
1.
Perfect. So now I'm just inspecting your anterior chest. Your skin looks wonderful, no obvious physical deformities. Now I'm going to palpate, let me know if any of this is tender.
Let this be.
Great. So now I'm going to do tactile firmness.
Okay.
So anytime my palm touches your anterior chest, just say 99 for me, okay?
99. 99. 99. 99. 99. 99.
Thank you.
99. 99.
Great. Now I'm going to percuss your anterior chest. So now I'm just looking for intercostal spaces. Just going to get under your shirt, please. Other side. Great. Heard resonance, which is exactly what I was looking for. Now I'm going to auscultate. So anytime my stethoscope touches the anterior chest, just take a deep breath in and out for me. If at any point you get tired, just let me know and we'll take a break. Okay? Just going to lift up. Okay? More time. Alright, your lung fields sound clear, no wheezing or crackles are present. So now I'm going to move on to your posterior chest. Do you mind just swaying your legs over for me?
Nope.
Are you comfortable like that?
I am.
Alright, so again, I'm just inspecting posterior chest now. Your skin looks great, well hydrated, and there's no obvious physical deformities. I'm going to palpate now, let me know if any of this is tender.
Nope.
Alright, great. And do you have any back pain?
I do not.
Great. Again, tactile firmness. Whenever my palm touches your Back, can you say 99 for me?
99, 99, 99, 99, 99, 99,
Just pick it up here.
99, 99, 99, 99.
Okay, great. And again, I'm going to percuss. So I'm just percussing, looking for resonance. Mind if I lift up your shirt?
No.
Great, thank you. Again, I heard resonance, which is a good sign. I'm going to auscultate again. So again, Emma, if you get tired during the process, just let me know. I'll take a break. So deep breath in and out. Just gonna lift up your shirt. Great, your lung fields sounded clear there as well. No wheezing and no crackles again. So feel free to swing your legs on over again. And I'm going to ask you to put your finger to your nose. Okay. And can you touch my finger? Great. And while I'm here, can you squeeze my fingers tightly? Great. Okay, Emma, we're going to start your cardiac assessment now. So can you lay down? Any past or present cardiac problems?
Nope.
Heart murmurs, dysrhythmias that you know of?
Nope.
Great. And no chest pain? Okay, so I'm going to start by palpating your carotid pulse. Alright, your carotid pulse is 2+, regular and normal. I'm also going to take your carotid pulse. I'm going to listen in 3 different spots, and right before I place my stethoscope on your neck, can you just take a deep breath in and out and hold it? Alright, ready for the other side? Okay, great. Okay, sounded great, and I didn't hear any breeze. So now I'm going to palpate your apical pulse. Just gonna lift up your shirt. Okay. Are you cold at all?
I am.
So I'm just going to get eye level. I'm trying to see your apical pulse pulsing. Can just barely see it. So now I'm I'm going to palpate it. Your apical pulse is located at your fifth intercostal space and a regular line. Your apical pulse is also 2 plus normal and regular. And now I'm going to listen to it. I'm actually going to listen to it for a full minute, so just bear with me. I'm going to make sure it coincides with your radial pulse. Alright, sounded great and it did coincide with your radial pulse correctly. So now I'm going to come back up to your precordium in order to listen to some heart sounds. And I already inspected your anterior chest, so your precordium also looks great. So I'm going to start by listening on the right side of the second intercostal space to the aortic valve area. I'm going to go over on the left side to the second intercostal space at the pulmonic valve area. And at the third intercostal space, the Erb's point. Then I'm going to go down to the left lower sternum and we're going to listen to the tricuspid valve area. And to your mitral valve area, which is located at the fifth intercostal space of the clavicular line. Alright, your heart sounds sound great. So up here at the base while I was listening, S2 was louder, and down here at the apex of your heart, S1 was louder. I didn't hear any murmurs, didn't hear any S3 or S4 sounds, so that was great. So moving on to your abdominal assessment, do you have any food intolerances that you know of?
No.
Any abdominal pain?
No.
Great. When was your last bowel movement?
Yesterday.
Okay. And do you have any vomiting, diarrhea, or nausea? Perfect. Still feeling pretty warm?
Yes.
Great. So I'm going to inspect your abdomen now. Your skin looks great, and your abdomen appears flat. I can also see that your umbilicus is midline, and then you don't appear to have your belly button pierced. Am I correct? Okay. So I'm going to start by listening to your bowel sounds. And I'm going to listen in all 4 quadrants, starting with the right lower quadrant. Going to go up to the right upper quadrant. And across to the left upper quadrant. Down to the left lower quadrant. I'm also going to listen for vascular sounds here. Alright, well you're hungry. I heard a lot of booger weakness. Your stomach was growling a little bit, but that's okay. I didn't hear any bruise while listening to vascular sounds. So now I'm going to percuss your abdomen. I'm just looking for tympany in all 4 quadrants. I'm also going to palpate in all four quadrants. So I'm just going to start with a light palpation first, just going about 1 centimeter deep. Let me know if there's any tenderness. Anything? No. Great, and I don't feel any lumps or masses. Now I'm going to go a little deeper, about 5 centimeters in. Let me know again if there's any pain. Great. Your abdomen looks great, Emma. So now I'm going to move on to your lower extremities assessment. Have you noticed any skin changes in your legs?
No.
What about any edema?
No.
And no weakness in your legs?
No.
Perfect. So I'm just assessing your skin. It looks well hydrated, but I do notice you have a couple bruises.
Yeah.
Do you bruise easy?
Yeah.
Okay. But they're not bothering you?
No.
Great. So I'm just going to palpate now. Your temperature of your skin is great, and I don't feel any edema or any other physical deformities. So now I'm going to try and palpate your popliteal pulse, which is under your knee. This one's generally hard to feel. Let me try the other leg. Okay, so I can't palpate your popliteal pulse, but I have checked your other pulses, and so far they have been normal, so your circulation appears to be fine. I'm also going to palpate your posterior tibialis pulse. Okay, those are 2 plus equal bilaterally. I'm also going to palpate your dorsalis pedis pulse. That's a little weaker, 1 plus, but still equal and bilateral. So now while I'm here, I'm going to just inspect your toes, make sure they look good in between. And I'm also going to check your capillary refill again. Color returns within seconds. So now I'm going to put my hands on the soles of your feet, and can you just press down like a gas pedal? And up. Great. And now I would like to test sensation. So can you close your eyes for me, please? So I have an object in my hand, and it has a sharp and a dull side. So I'm going to just rub one of the sides along the soles of your feet one at a time. Can you just tell me if it feels sharp or dull to you?
Sure.
Great. Now I'm going to do the other foot.
Sure.
Great. I'm going to come up to your legs and do the same thing.
Dull.
Yep.
Dull.
All right, and up to your arms.
Dull.
Great.
Dull.
Great. So keeping your eyes closed, I'm going to come down to your toes. I'm going to move your toe in a direction, and you just tell me what direction.
Up.
Yep, and now the other foot.
Yeah.
Great. So now I'd like to do some hip exercises with you. Do you have pain in your hips?
I do.
Okay, great. So I would like you to begin by lifting your left leg all the way up straight. Good. And the other one. Good. Now can you bring your left knee to your chest. And on your way down, can you rotate it laterally and over the inside? And now on its way down, can you drag your heel against your shin? Great. Now, same thing with your right. Knee to your chest, and rotate laterally, across, and drag. Great. So your range of motion in your hips looks wonderful, and I tested your cerebellar function by having you drag your shin from your knee down. Now I'm going to test your muscle strength. So I'm just going to give you some resistance, and can you lift up? Great. And now can you pull down? Same thing with the other leg.
Lift up.
Great. And pull down. Awesome. So 5 plus equal bilaterally. Muscle strengthen your lower extremities. So now I'm going to have you sit up for me, please. And I'm going to ask you to look up to the ceiling. And now flex your head down. And can you look that way? And the other way. Great. And now I want you to put your arms out for me. And I'm just going to push down. Don't let me push down. And same thing up. Great. And now I'd like you to bring your arms up all the way. Great. And can you extend them back as far as you can? Great. All right, Emma. You appear to be healthy. You're doing very well keeping up with your overall health. So you can lay back down, and I will have the doctor come in as soon as he can.
Thank you.
Stay healthy, Emma.